segment, but it's with Dr. Banji Filani, who is Commissioner for Health and Human Services. Because why? Health is wealth. It seems like we're making more wealth by just making health. Is that correct, Dr. Banji Filani?
That's absolutely correct. The more health you have, the better wealth you're likely to have. A healthy person becomes productive, and if you're productive, then you have a chance to contribute to the economy.
How does that tie into these events?
Absolutely. Well, you start from the realization that if you're not healthy, you can't even be here, right? And you being here means that you're able to carry on your job. If you're able to carry on your job, it means that you're contributing meaningfully to the society. And by contributing meaningfully to the society, you're helping yourself, you're helping those who depend on you, but also helping the country at large.
When investors come into Ekiti State and there is an emergency, what's the plan?
We have a tertiary...
And I'm not just talking about fire emergency, I'm talking about health emergency.
So think about it from point of accident, right, to get into a hospital. Ambulance services, and then moving from there to the hospital. We have 3 tertiary hospitals in the state. We have the State Teaching Hospital, we have the Federal Teaching Hospital, and we have arguably the best private sector hospital in Nigeria, in Abuad. We have general hospitals across the entire local government. 16 local governments, we have 22 general hospitals, all at different levels of capacity to be able to handle different cases.
So can they get the best of healthcare in short notice without going through lots of bureaucracies?
Emergency cases typically should not require bureaucracies. So yes, you will be able to get the best of healthcare.
But how about human capital development here, human capital development protection, or whatever it is that you think is important to ensure this investment attractiveness and economic development isn't just rhetoric, but an experience?
It's a good question. So if you start with human capital development with the person at the top, right, and which is His Excellency the Governor. He provides the political will and the authorizing environment that allows people like myself and my colleagues to be able to function appropriately. Then you look at a civil service that is robust. You have people who are willing, who are committed to getting work done within the system. I have 3 permanent secretaries, one in the Hospital Management Board, one in the Ministry of Health, and one in SPHCD, all with the relevant capacity to be able to drive sustainable programs. But more importantly is you move away from the civil service and then you go to the clinicians. We have very motivated consultants, we have motivated senior registrars, people manning, even in the face of significant challenges, not just in Ekiti, but across the entire nation, right? Manning general hospitals, working in our primary health care development centers. And as a government, we are alive to our responsibilities, doing the necessary trainings, providing the necessary inputs to enable them to be able to provide service delivery.
I'd like you to give me a little more assurance on that. You talked about civil service, because the experience many people have heard all over the nation is, look, when it comes to civil service, they do things at their own pace and not at the pace of the government that they're supposed to be a part of. So, please, I need a little more assurance. This is an investment summit.
I'll tell you a story. 8 years ago, a partner, Pax at the time, came into Ekiti and a couple more states and supported us with something called the DRF. Ekiti took it on board, and Kaduna, 5, 6, 7 other different states actually had to come learn from us. What am I trying to say? You have people here who have the commitment, who are thinkers and doers, and who want to go above and beyond.
Okay.
You would have, as with everywhere, you would have places where people drop the ball, and that's the responsibility that I have as a commissioner, to provide that technical leadership and to provide the oversight to drive things.
We could go on and on with you as well. You guys are just so easy to talk to you guys. But for now, we have to thank you, because we have to go. Dr. Banji Filani is Commissioner for Health and Human Services in Ekiti State.